Hi, I'm Dr. Betsy Greenleaf, America's vagina doctor, women's wellness warrior, and pelvic health expert. So, one of my fans asked a question about being pregnant and what can she do to help save the pelvic floor. Some women may notice that with subsequent pregnancies that the support in the pelvis gets a little weaker and things kind of start drooping and dropping. The number one thing that you can do to support your pelvic health is eat healthy. Your body needs the basic building blocks of nutrients to have healthy tissue. The next thing is to keep your pelvic floor muscles strong, and you can do that by doing your Kegels. Your pelvic floor muscles basically are holding everything in your abdomen, and they're working against gravity. So they're holding in your bowels, your bladder, all your pelvic organs, and in addition, with a growing pregnancy, that baby and that large uterus, which just puts a lot of pressure on the pelvis. So you want to make sure you're doing your Kegels. So how do you do the Kegels properly? Basically, the Kegel exercises are done by tightening up your bottom, like you're holding in your gas, stool, or urine. Now, you're not going to do these while you're urinating. That's not the proper way, but they're the muscles that you would use to hold in the urine if you had to get to the bathroom really quickly and you're trying to hold it in. So what you're going to do is tighten those pelvic muscles for a count of 10 and then relax and repeat that 10 more times. You can also do what's called quick flicks, where you tighten them very quickly and relax. So you go tight, 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 and then do that for a count of 10 and then repeat that 10 times. So you can repeat those sets for anywhere from 1 to 3 times, and you can do that once or once a day or a couple times a week. Start slow. If you're not quite sure where those muscles are, if you're able to reach around, put a finger in the vagina and see if you can tighten around your fingers, just to find the muscles. You can also get a partner involved to help you figure out where those muscles are. Or if you need to, you can ask your healthcare provider, such as the gynecologist, midwife, doula, see if they can help you, or pelvic floor physical therapist, see if they can help you figure out where those muscles are. You can also do some exercises strengthening the pelvic floor by using a resistant band between your knees and pull apart. Repeat that 10 times. Relax, and then do it 3 more sets of 10. You could also get a ball. This one works really well, especially if you're concentrating on your pelvic floor, and squeeze together while you're tightening up. And you're going to squeeze and hold and repeat that 10 more times. There are many different belly bands that you can wear that will not only save pressure off the pelvis, but also can help with the back. These are especially good as you get later on in the pregnancy and the abdomen becomes a little bit larger. In some women, your doctor may recommend a Pessary, which is a support device that's worn in the vagina. Sometimes this is needed to just add a little bit more support if things are starting to droop. It's also very important not to lift anything too heavy. And if you're going to lift, blow out as you're lifting. Just like the weightlifters do. You would want to blow out and reduce the abdominal pressure so you don't give yourself a hernia. Also, talk to your healthcare practitioner about how you're going to go about laboring. What I would recommend, working with your doctor, is that sitting up in an upright position for vaginal delivery is great for bringing that baby's head down in a controlled manner that lets those muscles stretch and tissue stretch, and then pushing at the appropriate time once the baby's head has come all the way down naturally. Now, once again, I do recommend that this is discussed with your healthcare practitioner because there's different situations that may require different interventions. Hope those tips help. This has been Dr. Betsy Greenleaf. Just remember, a healthy pelvis is a healthy life. And don't forget to share, like, and follow. Looking forward to talking to you again soon.